Absolutely. So first off, Victor, thanks so much for having me on today. It's lovely to connect with you. Again, my name is Jeffrey Moat. I'm the Chief Executive Officer of Pallium Canada. Pallium is a national social enterprise. We were founded back in 2000, so we're 24 years old. Our mission is to equip all healthcare professionals and communities with the knowledge, the skills, the tools to provide earlier, more effective, more compassionate palliative care for every Canadian. So in effect, we increase the capacity of our health human resources by ensuring they have a core set of skills ultimately to provide better care. But they do this in urban, rural, and remote, and even in Indigenous communities in every single province and territories. And over the past 24 years, Victor, we've created a suite of courseware called LEAP, L-E-A-P, which is an acronym for Learning Essential Approaches to Palliative Care. And these courses support interprofessional learning, multidisciplinary teamwork, and collaboration. And we know that the 60,000 learners who we've trained over the past 20 years report stronger networks, stronger connections following their training. So our vision is that palliative care is everyone's business. So that's a little bit about me and the work that we do at Pallium.
I love that. Thank you so much. Since our connection, I think that I'm more and more inspired by the work you're doing, but as well the narrative around the work you're doing and the why. So my next question is, what's inspiring you right now? What is you curious, or what's keeping you up at night, sir?
Yes. Well, listen, I have to begin by saying that it's my team that inspires me most about my work and our work at Pallium. I am blessed to be leading a team of young, talented, smart, driven entrepreneurial individuals who are all part of Pallium because they believe in our mission. They believe that the work that we do is improving practice. It's ultimately improving care for patients. So I take great inspiration from their ideas, the work that they do day in, day out. So that's first and foremost. I have to give them a shout out. But I also am inspired by the impact of our work. So while, as I mentioned, we equip healthcare professionals, all healthcare professionals, doctors, nurses, social workers, paramedics, pharmacists, and so on, with core skills to provide better palliative care. But by doing so, Victor, we're ultimately not just improving practice, we're improving care to patients and their family members, but we're also shifting cultures, which is so key. And so that's very inspiring, I know, to me and my entire team. And I'm inspired about the potential impact of our work because I think one measure of a society's commitment to its most vulnerable citizens is how that society helps people through the difficult consequences of life-limiting illnesses. And the reality is the vast majority of the some 270,000 Canadians who die each year and their families, they do not receive any palliative support care, or they receive it far too late. Right. So when I look at how many people we've trained, some 60,000 healthcare professionals, that's only about less than 5% of the entire healthcare workforce. So there's a tremendous potential associated with our work. And I'm also inspired by our ability to deliver value beyond the palliative care sector. I know you and I have spoken about some of the work that we're doing with the Black Health Education Collaborative, right? This has nothing to do with palliative care, but the reality is part of our skill set, Victor, is instructional design, curriculum development, course development. And so in a collaboration that we have with the Black Health Collaborative, who are associated with the Dalla Lana School of Public Health at the University of Toronto, was to develop a course focusing on the inequities in the healthcare system and the medical education system of Black people in Canada, right? So the privilege of being able to lend our skills, to tackling anti-Black racism in the healthcare system is incredibly inspiring to my team and to myself. So those are just some of the things that really inspire me and my team about the work that we do.
So, what challenges and barriers are you facing in your work right now? And what are some of the approaches you and your colleagues are taking to overcome some of these challenges and barriers?
Yeah. Palliative care, Victor, has a brand problem. We have an image issue, right? It's not well understood. It's not well understood by most Canadians. It's not even well understood by our healthcare professionals. Most people think that palliative care is care that's delivered in the last days or weeks of life, right? You often hear this, the statements by healthcare professionals or other care providers say, there's nothing else we can do, that this patient is palliative, right? That's not the definition of palliative care, right? Palliative care is an approach that improves the quality of life for patients and their family members who are facing challenges and problems associated with life-limiting illness, right? It prevents suffering, right, across the illness trajectory, right? It's care that's administered early, right, alongside active treatments to cure or control the illness, right? So it addresses suffering, right, but beyond physical symptoms, right? It's a team approach to care that supports patients to address their social needs, their psychological needs, their spiritual needs. So think of just good whole care. That's what palliative care is, but that's not how it's understood, right? So that is a big challenge and barrier to our work. So, and I think too, well, we all know, of course, that you know death and loss are inherent aspects of life. The current emphasis on finding a cure, right, or the apprehension that surrounds mortality also poses, right, obstacles to providing comprehensive, person-centered palliative care. And this often leads to inappropriate allocation and use of resources. So the conversation around living with disease and death and dying and bereavement has to be normalized, right? So shifting mindsets and attitudes among healthcare professionals through education, such as programs as Pallium's LEAP, I think are true culture shifting efforts in our workplaces. So that's a big part of what we're up against. But we take a lot of learning from our colleagues in the mental health sector, which is a sector that I used to work in, right? And look how far mental health has come in over the past 15, 20 years, right, Victor? A highly stigmatized part of health care that certainly has benefited from, I would argue, a very powerful and enduring social movement, right? Where we now have started to normalize conversations. I mean, more needs to be done, of course, but they've certainly come a long way. And I would argue palliative care is where mental health was, as I said, 15, 20 years ago. So that's a little bit about some of the challenges and the important role education plays in tackling some of that.
That's incredible. I love the knowledge mobilization, knowledge translation, and the awareness raising components of your work. Really important in terms of mitigating some of those misnomers and almost myth busting in terms of palliative.
Yes.
Yeah. So I really appreciate that. And it's a perfect segue to my next question. Do you have a set of key priorities right now in your work you'd like to amplify with our listeners and our viewers?
Yeah, well, it's actually quite a timely question because we just wrapped up our 3-year strategic plan, so it's top of mind for me, certainly. I mean, no surprise, based on what I've shared with you so far, Victor, number one priority for us is continuing to accelerate palliative care capacity building, right? So, this is a priority that really deepens our commitment to a proactive approach to building the capacity of the palliative care system, right? All while ensuring that we can meet increasing demands and challenges in a timely and efficient manner. So how do we spread and scale a trusted evidence-based solution, so that more Canadians can benefit from it? So that's priority one. Secondly is exploring new strategic opportunities that capitalize on our strengths, right? So how do we leverage these assets that we have, our capabilities, much like what I described with the Black Health Education Collaborative, right? Where we can succeed potentially in some new markets, right? Or new areas of business. So this encourages, strategic pilot initiatives aimed at, expanding potentially into new markets where our strengths can be an asset. And where there's a clear benefit, of course, to the healthcare system. And then the last priority is really around being able to leverage, emerging technologies, the research that we generate from our work, and innovative approaches to improve education and palliative care system performance, right? So this is about integrating, best practices, emerging content into our program curricula, evaluating and reporting on the current status of palliative care in this country. That goes to thought leadership, doesn't it? And it's also includes conducting, cutting edge research, right, on the influence of training on healthcare practices and ultimately patient outcomes. So those are the three priorities that are part of our 3-year strategic plan.
Incredible. Well, congrats. I know that a strat planning process is daunting, sometimes challenging, but it's always beautiful
Yes.
when you have those recommendations and the strategy at the end of it. So congrats again. So my second last question, what is your ultimate goal? And what does success look like and feel like to you and your colleagues?
I believe our ultimate goal, Victor, is to see a day where every Canadian, regardless of where they live, of what their economic status is, of what setting of care they may find themselves in, regardless of their race, their identity, that we all have access to quality palliative care. That is palliative care that puts the patient's needs at the forefront of care, that helps improve their quality of life, reduces or relieves their symptoms, right? Helps them make important decisions, right? Provides grief support to themselves and their family members, and supports them throughout their illness journey. So that's ultimately the goal, I think, that we have in front of us, and arguably that our entire sector has in front of them.
Incredible. So, do you have any closing thoughts or calls to action for our listeners and our viewers?
You know, I'm encouraged to see more nonprofit enterprises shift their approach to a social enterprise model, Victor. I'm seeing it more and more. I'm seeing more dialogue around this than I've ever seen before. Having this entrepreneurial approach to addressing social issues and creating positive community change, right? And breaking this nonprofit mentality. I've talked about this before, right? Building this culture of resiliency and grit, right? Getting away from this scarcity mentality, right? This idea of perpetually inefficient resources leading to this type of mentality, right? And we know what those symptoms are, right? It's all around cost cutting and small thinking. We're afraid to spend money, to take risks, right? And we're not going to be able to bridge this gap, right, to sustainable success with this kind of thinking, right? So these are some of the things that I just would love to leave your listeners with as we close off.
As always, my friend, it is always a pleasure to connect, to build, and to really unpack ways and means that we can advance multiple ecosystems, but most importantly, support some of the most vulnerable constituents in our great nation. So once again, I just appreciate your leadership, your candor, and your solidarity. And as always, it's set. So we close this conversation, this interview the way we began, by giving thanks to the original stewards of the various lands we're on. We give thanks to all our ancestors, all those who toiled, without compassion or compensation. We give thanks to all our elders and community stalwarts whose shoulders we stand on as we build, share, and learn together for our collective liberation and sovereignty. Thank you so much, Jeff. I appreciate you.
Thank you, Victor. Appreciate it.